This video is, are vaccines our best defense? That's what my husband's new doctor said was the truth. I'm not sure. What do you think? We spent about 40 minutes in his office on the first visit, and he was screening my husband, asking him questions about his past medical history, what medications he was allergic to, what surgical procedures he'd had, what his basic conditions were. And he said, do you get your flu vaccine? And my husband said, no. He said, why? So my husband said, well, when I was 65 years old, I went in for my checkup, my first Medicare checkup, and they gave me a flu vax, the pneumonia vaccine, and a diphtheria tetanus booster. And I got very ill, and I didn't feel right for 4 months. No response. I mean, the doctor didn't say, gee, what happened? What were your symptoms? And I'll make a note of that. I should put that on here, that you had rather, adverse reaction to that. And my husband and I said, well, we didn't know which vaccine it was since they gave him 3. And, one of them was a combination vax. And so we didn't know if it was one in particular or just the fact that they gave him so many at once. But I was just amazed thinking back over it when I got home. Why didn't you make a note of that and say, gosh, you had a pretty bad reaction. We need to maybe investigate that. Does anyone else in your family have adverse reactions to vaccines? But no, vaccines are our best defense. That was it. And when he said that to me, he said, well, vaccines are our best defense, and I said, well, maybe sometimes they are, and maybe sometimes they're not. He said, no, they're always our best defense. So I thought, why is it with vaccines that one size fits all? It's not a medically sound approach. Because here they are asking us, what medications are you sensitive to, what reactions have you, and yet when it comes to vaccines, they're good for everyone, no matter what your size is, no matter what your history is, no matter what, they're our best defense. And it made no sense to me, medically. So it's just something to think about. Why don't they ask you when they screen you if you've had any vaccine reactions before they tell you to get another vaccine? If you said that you took a sulfa drug and got really sick, they'd mark it on their chart. Oh, gee, we better not do that again, huh? But vaccines, get another one. You'll be fine. It's your best defense, even if it kills you. And here's another case in point. I have a little dog. She's right here on my lap. This is Maggie. She's a 5-pound Chihuahua, and she's 10 years old. And recently she was diagnosed with a stage 5 heart murmur, which is really pretty advanced heart disease in a dog. And it was shocking because we really didn't know she was sick. But she had an infected tooth, so we went to get that treated, and that's when they found it. In order to get her dental work done, they insisted that we vaccinate her. And I'm very gun-shy about vaccines because I've just seen so many people have reactions and so many animals have reactions. And so I thought, okay, well, we'll do the Bordetella, first. That seems like the least scary one. And I have a 13-year-old Chihuahua that had an oral Bordetella vaccine, and she did fine with it. But when I took Maggie in, they gave her the nasal spray vaccine, which is a live virus. I also took her twin sister in, Molly. I thought, well, I better get her one too because she needs her teeth done, and they won't treat her unless I get all her vaccines caught up. So 3 days later, Maggie almost died because I think her underlying heart condition made it much worse for her, and she actually caught Bordetella and had all the symptoms of Bordetella. She had a terribly gaggy cough and very lethargic and snot coming out of her nose and, things that she just has never had in her entire life. And then, so she ended up in ER on oxygen. She went into congestive heart failure. She just about died, and it took us a while to bring her back, and now she's medicated. But her sister got sick too. Molly got sick as well, and Molly fared better because she doesn't have the underlying heart condition. But when I shared with the veterinarian about their reaction, they were just incredulous, and their answer was, well, but we vaccinate so many dogs, and it's just so rare to have a reaction like that. And we just, we didn't intend to make them sick. And I said, of course not. But I thought to myself, how many 10-year-old 5-pound chihuahuas do you vaccinate all the time? Everybody's different. And the vaccines for dogs are tested on beagles, which are 20-pound animals. And my chihuahua is a quarter of that in weight. So would you want to get a vaccine that was tested on a 400-pound person? So anyway, these are questions that plague me, and I hope that the public wakes up to the fact that vaccines have taken a very special place in medicine that is not subject to normal medical rationale or logic. Everything is just fine, no matter what. And if you have a bad reaction, they want you to get another vaccination right away. They already said, well, we'll put it on her chart to give her the oral one next time. Like I'm going to put her, even take the risk again to kill her? So she doesn't catch kennel cough, which Bordetella is only one of the bacteria that causes kennel cough. There's like 30. So anyway, I just wanted to put this out there. Are vaccines our best defense? Really?